Hey, none of us like to be lied to. I certainly don't like to be, and I'm sure you don't either. But you realize that there's lots of lies in the Medicare world. And in this video, I'm going to expose those lies. Now, lie number one has to do with taking Medicare at 65. Many people are told that even if they keep working, they still have to take Medicare at 65, and that is absolutely not true. As a matter of fact, if you are still working or your spouse is still working and you're covered in a group plan of 20 or more insureds, you don't have to do anything with Medicare. You don't have to enroll into A, and you don't have to enroll into Medicare B. And as a matter of fact, some people will take Medicare A only, but if you take A, you can no longer contribute to your HSA. So all that money that's going to HSA, you have to stop that if you take Medicare A. Now listen, if you're in a group, a plan that has 19 or less, you are going to enroll into Medicare A and B. You're going to be required to because your group plan only pays second to Medicare. So you don't have to take Medicare at 65 if you or your spouse are part of a large group plan. Now, lie number two has to do with the cost of Medicare. In my career, I cannot tell you how many times I've heard people say this, that Medicare is free or it ought to be free. Folks, Medicare is not free. In fact, there are a couple things only that will be free on Medicare. Now, Medicare Part A does have a zero premium. It really is not free because you've been paying taxes all your life, but they offer that to you zero premium. Part B of Medicare always carries a premium. This year, that's $170.10 a month. So it's not free. That comes out of your Social Security check, or they will bill you for that quarterly until you go on Social Security. Now, in this system of A and B, the only thing that's free is going to be preventive services. Okay? So if Medicare says it's preventive, that will be free. But beyond that, in this A and B system, we've got deductibles, we have co-pays, and we have co-insurance. All right? So you're responsible for all of those. So it certainly is not going to get free. And now a lot of people in this system will get a supplemental plan to cover all those out-of-pocket expenses. And there's certainly going to be a premium for that supplemental plan. And then you have to have a drug plan. It also has a premium. Some people decide to get Advantage plans. They still have to pay Medicare, maybe no premium, but in this system, they still have co-pays, and they still have deductibles, and they still have co-insurance. And so, folks, there are very few things in Medicare. Once you go on Medicare, it will not be free. Yes, it's a bargain, but it's not free. Now, lie number three has to do with providers. There are some people who believe that it's hard to find providers that take Medicare, meaning primary care doctors, specialists, hospitals. Now, folks, the truth is this. Every hospital takes Medicare. Most primary care doctors, and I would venture to say almost all specialists, are going to take Medicare. Now, it is true that you may find a situation where we have a provider, a doctor, a primary care doctor, that doesn't take new Medicare patients. But we find that as long as you've had a relationship with that doctor, that once you go on Medicare, they will bill Medicare instead. Now, I did have a situation today where someone was looking for an oral surgeon that took Medicare. That was very difficult to find. Again, that had to do with some TMJ issues and teeth issues. But when it comes to medical issues, you'll be able to find providers for sure. Now, it is true that there are some doctors that don't take Advantage plans. That's one thing you got to make sure of when you take an Advantage plan. A lot of doctors will take original Medicare A and B, but maybe not the Advantage plan, so you always have to double check. But it is not true that you will not be able to find providers. Most are going to take Medicare, and you should get your health care services taken care of quite well. Hey, everyone, just real quick. We're trying hard to get this content to more people just like you who are looking for honest and helpful Medicare answers. So if this video has been helpful, you can help us out by hitting the like button and subscribing. Now, you could try signing up for Medicare alone. I wouldn't recommend it. But if you want free Medicare help from a Medicare expert, check out the links in the description. We literally help thousands of people every month make Medicare decisions. All right, let's get back to the video. Now, the fourth lie that is often heard about is this. This is in a situation when people are on Social Security benefits. In other words, they're already receiving a Social Security check. When they turn 65, they will be automatically enrolled into Medicare. And some will say because the card comes in the mail that they must stay on Medicare A and B. In other words, they have to stay on it whenever the card comes. And that is not necessarily so. Okay, now listen, if someone right now is on Social Security and they're turning 65 and they are retired, then yes, they are going to go on Medicare A and B. If they're covered by COBRA, they're going to go on A and B. If someone is covered by an Affordable Care Act plan, they went through the healthcare exchange to get insurance, they're going to go on Medicare A and B. Or if they or their spouse are still working and they're covered by an employer group plan that has 19 insureds or less, then in this scenario, yes, we are going to go on Medicare A and B. However, if you're on Social Security, you're turning 65, the Medicare card shows up in the mail, and your spouse are still working, and you're covered by a group plan that has 20 insureds or more, you do not have to go on Medicare A and B. Now, if I'm on Social Security, I have to stay enrolled in Medicare A, but if I have a group plan of 20 or more, I don't have to take B. And the way you make that decision is to compare that group plan with your Medicare option. Sometimes Medicare is better than the group plan, but if the group plan is better than your Medicare option, you can mail the card back in and you can drop off the B and you can have an A only coverage for Medicare. And then when you lose a group plan, you can enroll B at a later date called the special enrollment period. So we don't have to go on Medicare A and B if we have a group plan of 20 or more that's better than our Medicare option. Now for lie number 5. Number 5, you will hear people say that Medicare is an 80-20 plan. Medicare is an 80-20 plan, meaning Medicare pays 80% and you pay 20%, and some people feel like across the board, that's the way it works. And that is not the way it works. So when we look at Medicare, you have to realize first off that we have two parts to Medicare. We have Part A, which is the inpatient side of Medicare, and we have Part B, which is the outpatient side of Medicare. The Part A side of Medicare, we have a deductible. And then we have extended stays in the hospital that require copays. So we call these hospital copays. And then Part A also covers skilled nursing facilities. This is inpatient rehab. And they also have copays. So you can see on the A, the inpatient side of Medicare, it is not an 80-20 plan. It is deductibles and copays. On the B side of Medicare, again, we have a deductible, which is once a year. This deductible, by the way, can occur more than once in a year, but this is once a year deductible. And then we go into coinsurance. And this is the one place that indeed it is an 80-20 plan. So this would be anything on the outpatient side, doctor services, MRIs, CAT scans, outpatient surgery, durable medical equipment. It is certainly 80-20 there. Medicare pays 80, you pay 20%. This is why people get insurance to cover that 20%. And then lastly, there is a possibility of going to a physician that charges what we call excess. And this is when that doctor adds 15% to the Medicare bill. And you're responsible for that when that happens. And here's the whole point. Medicare is not an 80-20 plan. Yes, it is on the coinsurance on the B side, but everything else, the other 5 gaps, we have deductibles, we have coinsurance, we have copays, and we have this excess charge. Now, lie number 6 is this, that employer group plans are better than Medicare. Employer group plans are better than Medicare. So this is someone that is working or their spouse is working and they have an employer option. And many people believe that employer plans are better than Medicare. And folks, that's not necessarily the case. In fact, I encourage people as they approach Medicare eligibility and their spouses are still working and you're in a group plan of 20 or more, to always look at Medicare and make that comparison. Now listen, if you have a group plan of 20 or more, you don't have to go on Medicare A or B at all. Unless you're on Social Security, you have to take A. But if you have a group plan of 20 or more, you don't have to go on Medicare, but you ought to look at that as an option. And so the way you do this is making comparison. So what you're going to do is you're going to compare your group plan with Medicare, and here's what you're going to look at. You're going to look at the premium. What does it cost you to be on the group plan? What's coming out of your check? What are the copays on your plan? What's the coinsurance? Are you on an 80-20 plan? What's the deductible? And do you ever meet that deductible? What is the max out of pocket on the plan? So if you got cancer or something seriously happened to you, what would you spend in a given year? $10,000, $15,000. And then I also want to look at your prescriptions to see what the cost of prescriptions are on the plan. So these are the parts that you're going to look at on the group plan, and you're going to compare that to Medicare options. Okay? Now I will tell you this. My general rule of thumb is if this plan at work is costing you $250 or more a month just for your coverage, then you need to seriously look at Medicare. And this is why. You can get very good Medicare plans for $179 $175 a month, okay? And you can get the very best plans for right around $300 a month. Okay, very low deductible and very little out of pocket. So the point is, that's what Medicare is going to cost you. So you got to compare that to the group plan. Now, certainly, if you have people on your group plan, such as a younger spouse or children on the plan, then you got to bring that decision into the equation as well. But many, many times, Medicare could be an excellent option for you. Now, lie number 7 has to do with people that are on Medicare. And there are some that believe that if you're on Medicare, you also must be on Social Security. In other words, you got to start your Social Security if indeed you're going to start your Medicare benefits. And that is absolutely not true. Folks, realize that we're eligible for Medicare at what age? At 65. So as long as you have 40 quarters at 65, we're eligible for Medicare, but we don't have to be taking Social Security. Remember, Social Security, we can start taking it as young as 62, and we can delay it up until age 70. So yes, there are two government programs that have a lot of a relationship with one another, but I do not have to be on both to be able to take one or the other. And so what happens is this: if I am on Medicare and I am on Social Security, what happens is I pay my Part B premiums from my Social Security check. They take it right out of my check. So when I'm on both, that's the way I pay my Part B. But if I'm on Medicare, because it was the best option for me at 65, and I'm not on Social Security, then we actually have 3 ways that we can pay the premiums. We can be on a direct bill, and they'll actually send you a quarterly bill. We can pay it through an ACH, which is called Medicare Easy Pay. And that's a very good system, and they draft on the 20th of the month. Or you can actually go online and your mymedicare.gov account, and you can pay monthly online, okay, through that account as well. All right, so there's 3 ways in which we can pay for it. So we don't have to be on Social Security to be on Medicare. It just will alter the way in which we're going to pay our Part B premiums. But once we do take our Social Security benefits, then they will take that Part B premium out of our Social Security check. But until then, we have other options. Now, lie number 8 has to do with those that are still working. There are people that will hear the lie that they can't start Medicare until they retire. And folks, that's absolutely not true. In fact, there are many people today that are still working. They've said no to the group plan and yes to Medicare, and that's a fine decision to make. You just simply need to make a comparison. You see, we can start Medicare at 65 as long as we or our spouse have 40 quarters paid into Medicare. That's the Medicare taxes that come out of your check, FICA taxes. As long as we have 40 quarters, which is 10 years worth of work paid in, then we can start Medicare at 65, and every employer has to let you go on Medicare at that time. Now, beyond that, some employers will let you go on Medicare at 66 or 67 or whenever you want to, okay? They're happy to let you go on Medicare. Some employers restrict it to their open enrollment season, but everyone can start at 65, and then beyond that, then it'll just depend on what your company's policies are. But you always need to make a comparison to see what your Medicare option is versus the employer option. And I will tell you this, there are a lot of people today that will go to their employer and say, you know, I'm looking at Medicare as an option, and sometimes the company, since you're going to come off the group plan, they actually will give you a pay increase. Now, they can't make you go on Medicare, they cannot incentivize you, but they can certainly give you a pay increase and increase your pay because they no longer have to pay your insurance. They may be willing to up your salary. But you do not have to wait until you retire to start Medicare benefits. Sometimes it's better to go on Medicare while you're still working, when you're first eligible at 65 or sometime at a later date. Now, lie number 9 has to do with Medicare claims. There are sometimes I've heard people say that Medicare claims can be a real hassle. And I will tell you, that has not been my experience in all the years that I've been in the Medicare business. In fact, I found Medicare claims process to be a wonderful, wonderful process. And so I don't think there are hassles at all with claims. Now, what you have to keep in mind is when you go on Medicare, you're either going to use A and B with the Medicare Supplemental Plan, or you're going to have what is called a Medicare Advantage plan. All right? And so in these situations here, all you simply have to do is give them 2 cards. And you have to ask the provider 2 questions. Number 1, provider, do they take Medicare? And number 2, is that service going to be covered by Medicare? Because what happens, you give your cards to the provider and they're going to have to file that claim with Medicare. Medicare pays first, the balance is then sent to your supplemental plan, and then if you have a small balance that you're responsible for, they'll mail you the bill. But it's a very easy process. If you decide to have an Advantage plan, you actually have one card for all your health care needs, and what happens here is you have to make sure the provider is going to take that Medicare Advantage plan, that they're in the network, and they will bill that plan. You give them the card, and they will actually not file the claim with Medicare, they actually file it with the private health insurance company that's responsible for the bills after you have paid your copay. So in either one of these systems, there truly is no hassle whatsoever. If we ever have any hassles, it usually has to do with the provider not giving us the right code. And if Medicare doesn't like the code, Medicare Advantage plan doesn't like the code, then there could be certainly some kind of an issue. But that is not on Medicare, that is on the provider. Now, lie number 10 has to do when people begin to look at the cost between a Med Supp plan versus an Advantage plan. And there are people that will say to be on an Advantage plan is much cheaper. And I want you to know that is not necessarily so. So as we compare these 2 plans, if we go with the Med Supp plan with A and B, we have to realize that A and B, now A is free for most people, B has a premium. That's $170.10 a month for the B premium for most people. If you're high income, you pay more than that. Now, then we have to add a supplemental plan, and again, that varies across the country, but on average, about $125 a month for a supplemental plan, and the average drug plan right now is about $25, okay? So on a monthly basis, this option is going to cost us $320.10. Now, in this scenario, we've transferred most of the liability away from us. In other words, we have the supplemental plan that's going to cover all the gaps, except for maybe a small B deductible. Now, over here on the Advantage side, what we're going to do, we have an Advantage plan, and we have to, again, be enrolled in A and B. So A and B, I still have to pay the same for my B. That's $170.10 a month. But that Advantage company will probably charge me no premium to be on the plan, and they'll include a drug plan as part of the package as well. So it is true on a monthly basis. When I just compare premiums, Advantage plan is going to be cheaper. But if I need healthcare services, if I need an MRI, I have to go to the hospital, I have a CAT scan, and different things, services I'm going to need, now where will I spend the most money? Well, you're going to see over here, because we paid that supplemental plan, we got rid of all of our liability, except maybe a small B deductible. That could be $233 for the whole year. Out of pocket, out of pocket. Over here, out of pocket, that could range upwards to about $7,500. Okay, because here I go to the hospital, cost me $350 a day. Have an MRI, it's going to be $250. See, a specialist is going to cost me $50. So if I get sick and have some health issues, I could spend a substantially amount more money over here than what I would over here, just in premiums, because I got rid of that liability. Here I had to assume it. So we can't assume that necessarily that Advantage plans are going to be cheaper. On a monthly basis, yes, but throughout the years you get healthcare services, you could spend substantially more money on your Advantage plan. Now, if you're perfectly healthy and have no issues, then that could be the case. But none of us know what the future holds as far as our health is concerned. And we have to make the decision, which are we most comfortable with in using our Medicare benefits.